The main reason I'm a pediatrician is because I like prevention. My job as a pediatrician is to make sure that kids stay healthy and grow into healthy adults. In our office, we are now regularly screening our children for ACEs. ACEs stands for Adverse Childhood Experiences. There's an increasing body of evidence that childhood trauma, such as neglect, abuse, family dysfunction, can lead to long-term repercussions down the road. And those can be wide-ranging, from mental health issues like anxiety or depression, all the way to physical issues such as increasing rates of asthma, diabetes, heart disease, or cancer. It's been surprising how many patients have scored high on the ACEs screening tool. And it's really enlightening to be able to sit down with the family and say, you know what, we're treating your asthma with medication, and that's appropriate, but there might be another thing that's making this asthma bad. And I think if we work on some of the resiliency factors, that might help their asthma as well. The things I discuss with families are making sure that they get exercise every day, making sure they get adequate sleep. And we talk about mindfulness and meditation. We teach your kids how to control their stress. And for some, we talk about mental health referrals. And that's eye-opening for a lot of families. It's really taking a more holistic approach to treating disease in our office. I practice all of these things as well. I run most mornings now to make sure I get my hour a day of exercise in before I go to work. And I found that these techniques have been very effective for both me and my patients. I've been referring to the COVID-19 pandemic as a universal adverse childhood experience. In fact, and I'm not exaggerating, I've had more mental health crises in my office over the past year than I had in my previous 15 years of practice combined. My ACEs training, even though I was seeing lots of kids who had ACEs scores of 0, really helped because I was able to teach all of these kids ways to calm themselves down, to reduce the stress, and to be able to get back to life. The pandemic not only affects our patients, but it affects us as caregivers. And it's been really hard for us mentally, physically. It's been exhausting. What we decided to do was incorporate some things into our daily work schedule. For 5 to 10 minutes at lunch, we all sit around our front office and we do a meditation. We also started taking walks together, and just getting outside of our office is really, really beneficial, not only for bonding, but I think it improves patient care as well. I do believe that ACEs screening will become standard of care very soon throughout the country. And I'm proud to be part of a team that can identify these kids on a daily basis in our office, intervene early, and really benefit society and our whole community.